Hi, everyone. I knew that I would find this introduction a little bit embarrassing. Thank you. That was very kind. So I'm going to talk broadly about obesity policies, health policies for obesity prevention. And because many of you are probably not that familiar with the public health field, I just wanted to give you a 2-second overview of some of the major public health achievements just in the past few decades to give you a sense of some of the types of things that we work on from a public health perspective. So I focus on obesity, but just in the past 2 decades, there are so many areas of our lives that population has had an impact, or public health has had an impact either through surveillance and epidemiology and biostatistics, or through using that knowledge that inform policy decisions. And so areas like declines in breast cancer and colorectal cancer and maternal mortality, all of which remain unacceptably high, but have benefited greatly from public health research. Motor vehicle accidents, dissemination of vaccines for preventable diseases. These are all areas where public health has contributed significantly, and you can think back to sanitation and access to potable water. And so there are many, many ways that public health can touch our lives. And if you think about, well, what is it about public health that makes it different from the medical model? It's really, are we talking about one patient at a time, or are we talking about populations at a time? And so in all the work that we do, we're really focused down here at the bottom of this pyramid. How do we change the socioeconomic factors? How do we change policy, systems, and environmental change to really motivate healthier behavior? And it is not easy, but it is when you focus down here on this part of the pyramid that you can actually make meaningful change in a sustainable way. And so the area of public health, which has sort of grabbed my attention for the past 10 years or so, is obesity. And while I'm sure all of you appreciate that it's a problem, I do just want to take a second and underline how bad it is right now in the United States. And so what you're looking at here are maps of the United States in 2000 and 2017. So over here, yellow represents states that have a prevalence, or the number of adults who have obesity, up to 25%. That was the highest level back in 2000. Fast forward, not quite 2 decades, in 2017, and the only state in the nation that has a prevalence as low as 25% is Colorado. Every other state is higher, where you have West Virginia and Alabama, for example, with prevalences above 35%. By any definition, this increase is tremendous, and it's expected to continue to rise. And what's interesting to me, particularly about obesity, is that while it affects everyone, it doesn't do so proportionally. So now if you look at the top of the slide, you can see that there are big disparities in who's affected. Minorities, low-income populations have a disproportionate burden of obesity. And the story for children is the same. So now, looking at children, you've got the percent obese here, you've got time down here. If you look at this blue line, there's some leveling among the youngest children, ages 2 to 5, some signs of progress, but every other child from 6 to 18, their obesity rates are going up, and that is expected to continue. And that forecast is here. This is a study that was done by Steve Gortmaker in the School of Public Health. This is forecasting out expected obesity, and this came out in New England Journal of Medicine last year. So what this says is, take children who are age 2 today. 9% of them are currently obese. The expectation is those same children, when they're 35 years old, 59% of them will be obese. The challenge of childhood obesity is that it directly tracks into adulthood. Heavy children turn into heavy adults. It is so much easier to prevent weight gain than it is to get people to lose weight once they've gained it. And so in all the work that we do, the fundamental question is, how do you prevent weight gain? As opposed to, how do you get people to lose weight once they have it on them? So we've looked at federal policies, we've looked at local policies, and what I want to do with this time is talk about 2 specific examples, what the empirical evidence shows, and think about, what is the impact that might have on obesity. And so the first is menu labeling. How many of you have heard of this? Some of you, okay. So when I describe it, it's probably going to be familiar. So I'm sure all of you have heard of Obamacare. This passed in 2010, or the ACA, the Affordable Care Act. There was a very small provision included in that bill which said, if you're a large chain restaurant, you have to post calories alongside price. Prior to the federal law, there had been a ton of cities, maybe 25 to 30 cities and states around the country, which had passed similar legislation, which created all these cool natural experiments to answer the question, if you put calorie information on menu boards, does it have an impact on behavior? And then at the same time, some companies said, we're going to go ahead and voluntarily post information on menu boards. So we got really interested in studying what was happening. And before I show you what we found, just to give you a sense of this is what it looks like. Now, the law was kicked down the road a few times, meaning the implementation date got pushed back by the Obama administration and by the Trump administration, but it went into effect this past May of 2018, meaning that pretty much anywhere you go, here in Cambridge, if it's a large chain, movie theaters, and so on, you're going to see calories posted alongside price. And it's going to look like this. So here, the calories are over here for the crunchy taco. This is for a burrito order. The calories are right here, and you can see how it's blended in. The Food and Drug Administration, or the FDA, has very specific rules about how those calories have to be posted on the menus. So the question is, does it matter? And so there have been about 55 to 60 studies which have asked that question on the consumer side. If you put calories on menu boards, do consumers react? And what the vast majority of evidence is, maybe a little, maybe more so in coffee shops and cafeterias, but the signal is a change of about 10 to 20 calories. It's very, very small. And so we got really interested in thinking about maybe the effect of menu labeling is not that you and I make different choices. Maybe the effect is that restaurants are making changes. And that's important from a public health perspective because I won't ask you to raise your hands, but I'm sure all of you have New Year's resolutions that you've broken because we are very resistant to behavior change, and that's human nature. And because of that, wagging your finger at someone and asking them to make a change or giving them information may work for a short time, but it is often not sustainable. If you instead change the broader environment, in this case, changing what's offered in restaurants, that can actually have a big population health impact. And so that impact, you can see it here. So just to orient you, here you've got calories, average calories on the vertical. You've got time down here in the horizontal. This is data from roughly 70 of the largest revenue-generating restaurants in the country. So these are all large chains. This is fast food restaurants like McDonald's, it's fast casual restaurants like Panera, and it's full-service restaurants like TGI Fridays or Cheesecake Factory. And in this beige color, you have items that are commonly on the menu. These are things year over year that are always there. That's your Big Mac at McDonald's, that's your Whopper at Burger King. In orange, which is what you want to pay attention to, in orange are newly introduced menu items. So take-home point number one, the beige lines, if you follow the bar across, if you sort of track your eye across, is unchanged, exactly what you would expect. The Big Mac is not changing over time. It is sort of core to the business. But if you look at newly introduced menu items and you track them over time, they're going down by about 120 calories. Now, that may also sound small, but now I want you to guess. If you imagine roughly a 10-year period, and you have someone at a healthy weight, and they're eating too many calories daily, that's advancing them into the obese category. I want you to guess how many extra daily calories are driving that change over a 10-year period. Just throw out some numbers. 10, 500, 150. So for adults, it's 220 calories extra daily, and for kids, it's about 165. And so if you're taking people that are frequenting restaurants and you are just pulling out roughly 120 calories, that could actually have a pretty big impact on people's total calorie intake. And so then the next question comes, well, okay, if calories are declining, what is driving that? So we looked at that question and found that essentially what's happening is that the good fat's being pulled out to reduce the calories and sugar's being increased. So this is sort of like the underbelly, like you have a policy that appears to be having a positive public health impact, but there's an unintended consequence. This is problematic from a nutrition standpoint because it has implications for satiety. If you don't have enough good fat and you've got too much sugar, you're hungry. Think about like the snack-well movement, the low-fat movement, where we were sort of all scared of fat. That makes you hungry. And so this is just something to keep an eye on. But the big picture story is positive. Calories are coming down in restaurants, and that should benefit our health. The other thing that these restaurants are also doing is the highest calorie stuff is also being taken off the menu entirely. So if you, for example, compare items that are on the menu in 2012 to things that subsequently dropped off, what drops off is about 70 calories lower. And so we now, this year, have spent a lot of time using these same data to not look at things on an item-by-item level, but actually to build all the combinations that are available in these restaurants. So you walk into McDonald's, there's a number 1, a number 2, a number 3, across a whole host of restaurants. So we built those, and then what we've done is we've looked at what will be the default calories and saturated fat and sugar if you ordered the meal, and then what would be the calories and other nutrients if you maximized it or if you minimized it. So you might maximize something by getting a larger cut, a larger soda, or a larger fry. The calorie spread when you make those changes is phenomenal. It could be the tune of 500 calorie difference if you go from a default to a maximum. And so our hope is that it provides people with sort of concrete guidance. And it's important because the way the menu labeling rule is written is that if you remember back to that slide where I showed you in the top right, it was for a burrito restaurant, you don't have to say, the exact calories for every combination. You just give a range. You say this combination has between 400 and 1,500 calories, which is very unhelpful if you don't know much about calorie information. So our hope is that if we sort of break it down for people and say these are the biggest calorie drivers if you upsize or if you downsize, it should provide a useful tool out in the environment. So now I want to switch gears and talk about the beverage taxes, which is something we have spent a lot of time this year working on. So to put this in context, the US is not by any means the first place to think of beverage taxes. This is showing you globally activity starting before 2010 and going forward to 2019. So in red, you have countries or cities that have tried and failed. In green, you have countries or cities or states that have been successful. So as you can see, as we go advance in time, there's more success. Now, if you looked carefully, you'd see that some places like Philadelphia show up more than once, because in many localities there have been failures before there have been success. And this right here, this Cook County, was a really high-profile upset here in the United States. So Cook County is the greater Chicago area. They passed a beverage tax, which at the time, if you combined all the populations in the jurisdictions which had beverage taxes, Cook County was larger than those. So it had real potential for affecting a lot of people, and after 4 months, it was repealed. And you can also see that here. So this is just giving you a sense of where are the US jurisdictions that currently have beverage taxes. And so these range. Berkeley was the first, right here, with a 1 cent per ounce tax. But their taxes range from 1 cent per ounce to 2 cents per ounce. Some include sugar-sweetened beverages like a Coke, and some include artificially sweetened beverages like a Diet Coke. So Philadelphia, for example, is a place that includes both those types of beverages. Now, what's interesting is that if you look at the size of the tax and the amount of population covered, the expected annual revenue varies hugely. So Albany, California, 1 cent per ounce tax, the expected annual revenue is about $200,000. In Philadelphia, with a 1.5 cents per ounce tax, the expected annual revenue is $91 million. So hugely different, but big implications for local governments are looking for ways to raise money. So this slide has a lot of information, but there's really one main point that I want to make here. There have been a number of empirical studies of Mexico, which has a beverage tax across the entire country, and Berkeley, the first US city to pass a tax. The take-home point here is that when we look at the impact of these taxes on volume sales, meaning the amount of taxed beverages purchased, there's roughly a 10% decline. That's what I want you to think about in relationship to the results that we're going to show you for Philadelphia. So now let's take a deep dive into what we're actually seeing in Philadelphia. So in Philadelphia, again, it's a 1.5 cent per ounce tax. It includes sugar-sweetened and artificially sweetened drinks, and it went into effect on January 1st, 2017. And so we're doing a number of different analyses in Philadelphia, and what I'm going to show you is just the analysis looking at what's happening in the big stores. We're doing a complementary analysis in the small stores, like corner stores and independently owned stores, and I'll voice over how the results are similar to what we're seeing in the big stores. But the first point to make is, in the United States, all of these beverage taxes are excise taxes. What that means is it's applied to the distributor, who passes it on to the store, who passes it on to the customer. So the first order question is, if Meredith owns a store down the street and she sells taxed beverages, do I receive the full weight of the tax as a customer, or does she only partially pass it through to me? And so if you assume full pass-through, meaning I experience as a customer the full weight of the tax, this is showing you how the prices of commonly purchased beverages would change. So if you focus in on this 2-liter bottle of Mountain Dew, if you apply a 1.5 cents per ounce tax, you've increased the price by $1. If the base price was only $1 to start off with, you effectively doubled the price. To a consumer, that is very shocking. And so then the question is, does that impact sales? So the questions that I'm going to answer for you are the impact on price and the impact on sales. To do that, we're doing a natural experiment. One big limitation of past analyses is that they don't have a control group. You care about a control group because you need something to compare your results to show, is it a real effect or is it some sort of secular change? And so what we're doing is we're taking Philadelphia, our intervention, we're comparing Philadelphia to Baltimore. Baltimore is about 90 miles south of Philadelphia. It's a similar city in terms of demographics, and it does not have a tax. So it serves as a really nice control for this analysis. We're also interested in tax avoidance, the idea that you think, I'm not going to buy tax beverages in Philly. I'm going to leave and buy my beverages outside. And so to get at that, we have to collect data in the surrounding counties surrounding Philadelphia. And here's what that looks like. So Philadelphia County is the exact same geographic area as Philadelphia City. So you can imagine of this as Philadelphia City. And then here are the surrounding counties. So we also have data from stores there to get at this question of tax avoidance. So what we care about is, does the tax affect price? First order question. Second order question, does the tax affect sales? And to do that, we've purchased data from a company called IRI. And so in that data, we have supermarkets, think Stop and Shop, think Star Market. We've got mass merchandisers like Target, and we've got pharmacies like CVS. We have data for a full year before the tax, and we have data for a full year after the tax. This is data that we can purchase. For the small stores, we actually had to go out into all these stores and collect these data on our own. And so what we get in the data were roughly 24,000 unique brand flavor combinations. So a Coke is a brand flavor combination, and a Cherry Coke is a brand flavor combination. And for all those, we had to code them into categories. We had to say, is it taxed or not taxed? Is it sugar sweetened, artificially sweetened, or unsweetened? And is it a family size, or is it an individual size, meaning less than 36 ounces? For the purposes of the talk today, I'm just going to show you the results for taxed versus not taxed. So, did it matter? Did it have an effect? And so let me orient you to this slide here. So here you have price per ounce on the vertical. Down here you have time. You're going to see a series of 3 lines go across the screen. Philadelphia is going to be in blue. Baltimore is going to be in orange. And the counties are going to be in yellow. So this is the year leading up to the tax. So this is the average price per ounce in the average supermarket. Because there are differences in pass-through by retailer type, we're not looking at them all together. We're looking at supermarkets separate from mass merchandisers, separate from pharmacies. The tax happens, and here's the change in price. This is Philadelphia up here. And so that change represents 43% pass-through. So a little bit less than half of the tax was passed on to the consumer. And then if you look at the other outlets, it's fully passed through in pharmacies, and it's a little more than half passed through in mass merchandisers. So now you know what the customers are experiencing when they walk into these stores. So does that impact volume sales? Keep that 10% number in your mind of what we're seeing in Berkeley. So now this is showing you the result for volume sales. So that's on the vertical. You've got time down here with the same color orientation. And this is at the city level, combining all the different retailers together. So this is life before the tax. This is the tax. This is the drop in volume sales, 51%. Now, you can't just look at 51%, which is enormous. You have to also focus on the fact that there's this little bit of an uptick happening here. That's tax avoidance. That's people leaving Philadelphia to buy beverages elsewhere. So what I'll show you is how we take that into account and what our final number for volume sales is in just a second. But before I do that, I also want to make the point that while Berkeley saw an increase in non-tax beverages, we see no change here. So it's not that people are saying, well, I'm not going to buy a tax beverage. I'm going to instead buy water or milk or something else. People are choosing not to buy a beverage, which is interesting. And so when you take cross-border shopping into account, it represents roughly a quarter of sales. And so we're seeing a decline of 38%. That's about 1 billion fewer ounces of tax beverages being purchased in Philadelphia 1 year after the tax. That is a huge public health success story. And the reason is because sugar from soda is the largest source of added sugar in our diets. And it is strongly linked to obesity and diabetes and dental caries. And so if through this tax, by reducing volume sales, you subsequently reduce consumption, you can most likely have an effect on obesity. We don't know that answer yet. It's being looked at now because you need more of a runway to actually look at effects on weight, but it's very probable. And so the population health impact here is probably quite large. And so what we also looked at, there's several areas that anti-tax groups focus on in trying to push back against taxes. And so if you follow any of the local debates, millions and millions of dollars usually get pumped into areas that are trying to consider beverage taxes from groups that don't support them. And that's often run by the American Beverage Association. And so one of the main arguments is it's going to hurt overall supermarket sales or retailer sales. Another main argument is that it's going to cause people to lose jobs. And so we've also looked at those two things in an effort to try to answer those questions in the context of Philadelphia. And so with respect to combined sales, which is looking at beverages, food, and household products, it doesn't include everything, so it doesn't have like the jewelry case at Target, but it has almost everything in the store. When you look at supermarkets, we're seeing an 8% decline in combined sales, which for supermarkets may not actually be insignificant. However, it is also the case that the supermarkets in Philadelphia are also outside of Philadelphia because they're chains. So it's probable, although we don't know it from our data because we can't, it's probable that if it were, say, a Star Market, which is not in Philadelphia, but you guys know it here, if it were a Star Market, people are choosing not to go inside the Philadelphia city limits, but they're choosing to go to a Star Market outside of the city. So it may not actually hurt the bottom line of the retailer overall. It may just be hurting the retailer in that specific setting, but we can't know that from these data. We're seeing very little change in the average mass merchandiser. These are like your targets. And we're seeing no change in your average pharmacy. So then if you ask the question, well, does the tax impact unemployment claims? This is a paper that we did that just came out last month. The answer is no. So what you're looking at here is this is time leading up to the tax. You have Philadelphia in green, and you have the neighboring counties in blue. You have the tax happening here. And you can see the lines track over time. And the takeaway is there doesn't appear to be any impact on unemployment claims as a result of the tax. Now, there are many other questions related to unemployment that we'd want to ask, but these are the data that we have at the moment. But you put all this together, and the story of the beverage tax seems to be it's really having both a positive public health impact, it appears to be putting money in people's pockets, and it doesn't appear to be having a hugely negative impact on the economy. And so this, hopefully, will push other cities to think about similar taxes. And what Philadelphia has done is one of the ways on their third attempt that they got this bill to pass is they didn't make it about health. They made it about universal pre-K, they made it about green space, they made it about community centers. So in the first year of the tax, they established more than 4,000 slots for kids to go to universal pre-K that otherwise didn't have access. So there are lots of ways the money is being given back to the community, which could also improve health in indirect ways. So it's worth asking, if we're seeing a roughly 40% decline in Philly and we're seeing a roughly 10% decline in Berkeley, why do those differences exist? So one obvious one is the taxes are different sizes. In Berkeley, it's 1 cent per ounce. In Philadelphia, it's 1.5 cents per ounce. So that's possible, but the Philly effect is more than 50% bigger than the Berkeley effect. I think probably the biggest driver is that Berkeley is just not a typical US city. And in Philadelphia, you have many more urban people, well, many more low-income people, many more minorities. It is the case that low-income minorities tend to drink more soda. So I think you have a larger number of consumers and you have a larger number of high consumers. And that's probably it's probably a big reason why we're seeing much larger effects in Berkeley. The other thing that happened is there was a whole lot of reaction from retailers when this tax first came out, sort of making it clear to customers that if I'm a store, this isn't my tax, this is coming from Philadelphia. And that could have influenced people. And so here, I think I took the slide out. But there were several examples. But if you think back to that 2-liter bottle of Mountain Dew that I showed you, there's a shelf tag that we had from ShopRite where the price of the 2-liter bottle of ginger ale was 99 cents. And they added a tag saying, and the tax adds $1.02, just so it was clear to customers, like, here's our price, and here's the price because of the tax that just got implemented. And that kind of thing may have influenced consumers at the point of purchase, but we don't have those data, and so we can't evaluate that. So I just want to wrap up by saying a few things, and just make a few points about other areas that we're working on through this time here at Radcliffe. So if I had one main takeaway, it would be that when we think about what's driving obesity, it's not these massive numbers of calories. It's relatively small amounts of calories on a given day. And so then the question is, if we know that, how do we pull out calories from some of the low-hanging fruit, like sugary beverages, for example? And I often will give talks, and people will say things like, well, why don't we just get rid of fast food? And why don't we just do these other very impossible things? And I think it's really important to recognize the world that we live in, recognize that food is so important to people, and meet them where they are. And so the restaurant setting then becomes a really important place to focus on. On a typical day, a third of children and a third of adults are eating in these settings. And so if calories can get pulled out, particularly in the stealth health way that we're observing right now, that can have big population health impact. And then if you target behaviors where the risk for those behaviors is higher among vulnerable populations, then not only can you make everyone better, but you can also attenuate these long-standing disparities that have existed in things like obesity and diabetes. And so for the Philadelphia beverage tax, we don't know what the health outcome, what the health effect will be. But it's possible that the effect of the tax will be largest among low-income and minorities, which means that the potential health effects would also be largest among those groups, which is also a very positive public health story. And so in terms of other things that we're working on, another project which occupied us a lot this year is thinking about SNAP, which is what Meredith mentioned at the beginning. So this is a Supplemental Nutrition Assistance Program. It has a budget of $70 billion per year. It serves about 40 million Americans, and it is designed to provide nutrition assistance to help families eat on a monthly basis. So you effectively have what looks like an ATM card. It has money loaded onto it, and the average amount for a family is about $250 a month. It is supplemental. It is not sufficient typically to live on. Right now, you can purchase virtually anything with that card. And so we've been writing this big review paper on what are some ways we can improve the public health impact of that program knowing that there are some areas where if you try to sort of use behavioral economics or change incentives or change administrative policy, there's real potential to try to bring more nutrition to the program, because its primary aims right now are lifting families out of poverty and reducing food insecurity or hunger, both of which are very important. But we have to, I think, modernize the program to make it consistent with life now, which is a lot of low-income people in that program have a lot of diet-related diseases. So should we think about the foods you can purchase with SNAP benefits and whether or not there should be some changes there? And I would just end by saying, I think the reason why this whole area of obesity prevention / food policy is so interesting is that the way to have impact is not to have a single thing that works. The way to have impact is to figure out what are all the multiple things that we can do in concert to really have an effect. And that requires multiple lenses from multiple disciplines. It requires multiple types of stakeholders. And it requires a commitment to try to push the same agenda forward. And so I think it makes it exciting and hard and challenging, but an area that I think we will see progress in the coming years. So thank you.